I currently work at the International Union Against Tuberculosis and Lung Disease as a senior advisor. I also have a position at the London School of Hygiene and Tropical Medicine in London, UK.
What do you think about this conference?
Well, it's very nice to be at this conference. I've been working most of my life, in fact, in sub-Saharan Africa. I was there in 1983, left in 2008, so I spent 25 years living and working in Africa, and obviously saw the beginning of the AIDS epidemic and saw it unfold and have seen the response. So it's very exciting being at one of these conferences. This is, of course, 22 years since America hosted one of these large conferences, so it's very nice to see America hosting this again, given that America is really a very important donor in terms of financial support for the fight against HIV/AIDS, the fight against tuberculosis, and of course is a great technical supporter as well of what we're trying to do.
You are an expert on tuberculosis. What is the connection between TB and HIV and AIDS?
Okay, let me briefly try and say tuberculosis has been around for thousands of years in human beings. And many human beings carry the TB germ inside their body. 2 billion people in the world carry the TB germ. HIV is a new arrival on the scene, probably arrived on the scene about 50 years ago. And unfortunately, what HIV does, it suppresses the body's immunity, and the body's immunity is so important in fighting the TB germ. So when the body's immunity goes down, the TB germs inside are allowed to multiply, and when they multiply to a certain level, they cause disease. And that disease we recognize as tuberculosis. So that is basically the link.
Do you like to connect the fight against TB more to the fight against HIV and AIDS than today?
I think the fight is interlinked very much. I mean, my background is Africa, so when I went to Africa in 1983, tuberculosis was a major problem. HIV/AIDS was not then a problem. And then what we saw unfold on the ground was HIV/AIDS rapidly escalate, and along with that, TB escalated out of control. So in Malawi, where I worked, in 1985, we were reporting 4,000, 5,000 cases every year. 15 years later, that was up to almost 30,000 cases a year. So you can imagine in a small country with all these numbers of cases, and we didn't pick up everybody, so we were missing a large number of cases. It created a real problem. And TB, HIV was a huge killer amongst our adult population, and also amongst the children as well.
What can the fight against TB learn from the fight against HIV and AIDS?
Well, you know, it's quite interesting. I'd put it the other way around, if you don't mind. I think the fight against HIV/AIDS can learn a lot from the fight against tuberculosis. If you look at the history, it is very interesting. In the drug therapy against HIV, we went from 1 drug to 2 drugs to 3 drugs. You know, in the TB world, we learnt in the 1950s that we made the same mistake in the 1950s. We went from 1 drug to 2 drugs, and eventually we went to what we call combination therapy in TB control, because you get drug resistance. The HIV/AIDS world, we should have learned that from the TB world right back in the 1980s. Of course, the drugs had to be developed, all right? The other thing is, in the TB world, we have a fantastic system of what's called case finding, treatment outcome cohort analysis. We have a monitoring system that allows us in the poorest countries of the world to accurately record who's coming on to treatment and who stays on treatment and what are the outcomes. And I think we've learned that in HIV/AIDS, but we've learned it a little bit late. The other way around, though, certainly what we have not done in the TB world and what was so great in the HIV/AIDS world was activism. We were so bad at that in tuberculosis. We tended to sort of say, we know how to do it. We were a bit conservative, and I think we've learned. We've learned that we need activism. We need people to shout, to make a noise, and to actually, you know, make sure we're accountable for things. So there's a learning curve, I think, or a learning experience that both diseases, both communities can learn from each other and can teach each other.
What is the present spread of TB in the world?
It's coming down. It's not bad. We have every year about 9 million new patients estimated to occur in the world, all right, of whom we identify about 2/3. So that is a problem. We do not identify 1/3 of all the TB patients that occur each year. And this is one of the areas where we need to improve, because if you don't find people, they spread the disease and they die undiagnosed. But we've made good progress. I think that the system of TB control is great. I think WHO, I'm a great supporter of WHO here. They've been a great leader in this. The organization I work for also was strongly supportive of WHO. And I think we're making inroads, but there's challenges, definitely challenges.
What is your message at this conference?
My message is, I think, let's be bold. I think we've got the science now that says to us, listen, we can do things, we can turn this epidemic around. We have challenges. We don't know quite how to do this in the field, but my address to the conference would be to say, listen, we need to do this. We need to be bold, we need to go forward, we need to document very carefully what we're doing, but let's not be hindered because we don't have all the answers. I think I'd say, listen, we go forward even without having all the answers, and we learn as we are going along.
What do you think is the next thing to happen in the fight against TB? What's the next step?
Yeah, that's a very good question. It's actually improving the diagnosis. The key thing with tuberculosis is making a much easier diagnosis. I won't go into details, but at the moment, a patient has to submit sputum. Yeah, that has to be looked at under a microscope. It's not great that we have new machines that have come on board, but they're a little bit expensive. They can't be at the health centers. What we really need is a point of care TB diagnostic test. A little bit like we have for HIV. Finger prick onto a little strip, 10 minutes, you have the answer. That's what we need for TB. And if somebody finds that and produces something that costs less than $2 a test, that will definitely help our fight against tuberculosis.
Can you treat TB fully today?
Absolutely. We can treat drug-sensitive tuberculosis, we can treat fine, right? We have a problem with drug-resistant tuberculosis. Estimates are 500,000 multi-drug resistant TB cases, much more difficult to treat, but we can treat them. And again, there are approaches to that. We've got to be bold and look at simpler, shorter treatment regimens, try them out, prove that they're effective, roll them out. But we can do it.
It's a lot of funding going to the HIV/AIDS. Do you think that there is a lack of funding to TB?
You know, again, interesting. I think many middle-income countries probably fund their own TB epidemic from domestic resources. The worry is the low-income countries, like the country I worked in, Malawi, where without external support, we have a problem. Yeah? So most of that funding, in fact, comes through the Global Fund. And with the Global Fund in the crisis it's been in, there's an obvious concern that we don't have enough money. So, you know, again, my answer to your great question there is we need to make sure that the external money goes to where it is really needed and say to middle-income countries, you can do this. You find the domestic money and we concentrate money where actually we need to help the people.